Hey, my name is Cynthia Abear, and I'm going to be discussing the drug Theophylline. So, the brand name for Theophylline that I chose is Theolair. There are several brand names out there, though, for Theophylline. The drug class for Theophylline is xanthine or methylxanthine. Theophylline works by relaxing the bronchial smooth muscle in the pulmonary vessel. This helps the patient breathe better. Theophylline aids in the treatment of asthma and COPD. Theophylline is most often prescribed by an oral route. I read that there are ways to give theophylline intravenously. However, that's not common practice. So as a provider, we would start the patient out at a dose of 6 mg per kilogram per day of theophylline. We would draw serum theophylline levels to determine whether the dose needs to be increased or decreased for the patient. Patients should avoid caffeine when taking theophylline because theophylline has similar effects to caffeine. They should avoid charcoal broiled foods. A low-carb, high-protein diet excretes theophylline faster, and as well a high-carb, low-protein diet decreases the excretion of theophylline. So a patient needs to have a well-balanced diet to be on this medicine. There are several drugs that interact with theophylline, some of which include beta blockers, antibiotics, and even the flu vaccine has adverse interaction with theophylline. So just tell your patient that to make sure they notify you if they have a new medication they're starting or if they're trying to get a vaccine. A serum theophylline level should be done frequently, 6 to 12 months once the patient is on their maintenance of theophylline. The normal theophylline level should be 10 to 20 micrograms per milliliter. Some adverse effects the patient may experience include insomnia, headache, GI issues are very common, such as nausea, vomiting. Patients may experience heart arrhythmias and even convulsions. So a contraindication for theophylline would be if the patient has an allergy to xanthine medications. Patients are also contraindicated if they have a pre-existing seizure disorder or peptic ulcer disease. Adherence with theophylline is very important. The possibility of toxicity is very common with these patients. They should advise their provider of new medicines or changes in their diet. Patients with congestive heart failure have decreased metabolism of theophylline. They should also be monitored closely for toxicity.